Trichomonas vaginalis. These words are easy to just cut the vaginalis because the vagina and then lis, vaginalis, at least. But this one is an STD. This one is a sexually transmitted one. So this one is caused by also what is it? Of course, the bacteria or the microbe is actually Trichomonas vaginalis, and it's an STD. So a man can transmit it to you. Okay, they can actually carry it from one woman to another, and women can actually spread it through sexual encounters. And this is the reason why your gynecologist asks you all the time about your sexual encounters, possibly suspecting you have Trichomonas vaginalis. And this one comes with a very itchy feeling, okay, burning sensation and itchy feeling, and then a very frothy discharge. Looks like when you go to urinate, you're producing that foam. So it's a frothy discharge and it smells very bad. Okay, and this one will cause you a lot of painful sex. When you're having that sexual encounter, it becomes very painful. So this one has to be taken care of. And again, a drug of choice in this one is what? Metronidazole, aka Flagyl. Now on to the fungal one, the Candida. And this is where we can put our feet down and talk deep about it, because this one is always recurrent in women. Women taking fruits, women taking honey, women taking sugars. This one has to be part of that. Women who are on hormonal contraceptives. Remember, the hormonal contraceptives actually lower your immunity as a side effect. So when they lower immunity, they also affect the vaginal pH, and therefore they give a chance for the Candida albicans to come up. The word albicans, albicans, actually is derived from something called white. So when you produce it's like they call it a cheese-like discharge, having those whitish things coming from that organ. Now you start to know that one is a yeast infection. And also this one is a very, very itchy one. So there's an itchiness and all that. But this one is an opportunistic infection. So this one does not just come just like that. No, because remember, Candida albicans is a microorganism that actually inhabits the vagina, so stays there. Okay, doesn't cause any harm until the immune system goes down. When your immune system goes down, and the immune system goes down during pregnancy, your immune system goes down during menstruation or sometimes ovulation, your immune system goes down when you're using hormonal contraceptives, and of course, anytime you're consuming the inflammatory foods, your immune system is going down slowly because of the fatty liver. So this is actually going to expose you to the opportunistic infections. Also, cancers and anti-cancer medication, they cause you this problem. Why? Because cancer on its own, it lowers immunity, and then cancer medications actually destroy the bone marrow, which is part of your immunity, so they lower the immunity. So therefore, women who are on anti-cancer, women who have cancer, women who have diabetes, this is what they're going to go through. So when I talk about diabetes, and by the way, diabetes is a very, very, that thing. My friends, please take care. You might think it's a joke as we talk about diabetes until you get to experience problems that are coming with diabetes. You will talk to somebody today, and in the next 3 months, this guy is going for a dialysis. In the next 4 months, this guy is dying. And he will die in 4 months, and he will have drained a lot of resources, both money, physically. He has drained the families and all that. So diabetes is not a joke. Please do not treat it as a joke. And this is the reason why, because people who have diabetes have recurrent yeast infections. Ladies, please. As you head towards menopause, as you use that contraceptive method, those hormonal contraceptives, as you eat those sugars, as you eat those fruits and the pineapples, hoping that you can actually make sure that the environment is safe, you're actually causing yourself more problems. So it's time for you to take care of yourself, because again, nobody will tell you these things. Because you see, you being sick and you being maintained as sick, you're actually a business to some of us. So imagine if somebody has diabetes. I am reaping so much from them. One, I am reaping from them through consultation fees if I'm a healthcare system. I am reaping through them from them through the devices that I'm giving them, the kits to measure the blood sugars, the kits to measure blood pressures and all that. I have not even mentioned the drugs that are coming in. Every single month we are having a new drug and a new drug combination that is treating the same disease, that is doing the same things that other drugs have been doing, only that the name is the one that is changing. So today is this name, next month is another name. And Medress are there marketing it. Totally. Marketing it very effectively. But the mode of action of these drugs is the same. The only difference is the combination. So imagine that. So you are the one who is being taken advantage of, and you will never know. And actually, if you have a healthy insurance cover, you are a target of many hospitals. And as you sit there thinking that, oh, this type of hospital is the best, there is no better hospital than your kitchen. None. There is no better insurance than you fixing your kitchen. There is no better diet than you eating healthy and fasting. Fasting is actually a diet, if you didn't know. So as you maintain that sickness, as we actually help you to maintain that sickness. So as we maintain that sickness in you, we are reaping a lot from you. Consultation fees, the kits, medication, and medicines, and you know very well, you can bargain any other thing, but the hardest thing to bargain, imagine standing in a pharmacy and bargaining drugs. People are like, "Ay, huyu naye ametoka wapi?" If somebody, and that's why pharmacies are making a lot of money, because you cannot bargain drugs. They call the shots. I can buy a drug at 6 shillings and I sell it at 50 shillings a tablet, and you'll never ask me why, because you see, you don't understand it. You don't have the monopoly. You don't understand it totally. I'm the one who has the monopoly. As you maintain the sickness, or as we help you maintain the sickness by masking the symptoms, we are actually reaping a lot from you. Look at it. Look at the diseases that we call the chronic conditions. The one that they tell you is lifestyle diseases. So instead of them telling you it's just dietary diseases, they tell you it's lifestyle. Look at them. One patient who has diabetes, chances of this person getting hypertension are very high, because diabetes kills the kidneys and the kidneys maintain blood pressures. So drugs for diabetes are there, drugs for hypertension are there, kits for testing blood pressures are there, kits for testing blood sugars are there. Now, all the time you're in hospital because of a flu, because of low immunity. All the time you're in hospital because of an ulcer, a wound ulcer. You're on high doses of these drugs, but you're still getting a wound ulcer that doesn't heal because of low immunity. And as you continue doing that, the only thing we can do is to actually change the form of sugar. So we tell you, do not take the sugar that you add in tea, but you can take sugarcane. Now, I told you sugarcane is sucrose, which is fructose and glucose. Table sugar is sucrose, which is fructose and glucose. So diabetes is a major factor in candidiasis because of the sugar. Antibiotics use, they destroy lactobacillus, and therefore they give fungi a chance to come up or proliferate. And then HIV and the cancers, because these are the diseases that actually target your immune system, and then now you expose yourself to problems with the fungi. Of course, hormonal contraceptives are there. And then hygiene. I told you about women overdressing. Sometimes it's a hot season and women are overdressing. Sometimes women just go and buy things and they are putting it on and anyway. And this candida is actually the same that plays a role in the diaper rash in children or babies. So you can easily know the itchiness that comes with that, the stubbornness that it comes with. Ladies, this one cannot happen. But this one, the good thing about this one is, one, if you boost your immunity, you suppress him. He goes back to where he belongs. So simply, if you know the causes, if you know the risk factors, if it's diabetes, reverse diabetes. It's very reversible. Today, on my Telegram platform, I put out a leaflet that is coming from that. There's this insulin injection that looks like a pen. And it's so swaggerific. And you think that this pen is going to write a new chapter in your diabetes book. It's going to write you the guidelines to reverse diabetes, right? So that pen is actually a combination of two types of insulin, the rapid acting and the long acting, okay? And that pen, inside the box, how can I get your Telegram? My Telegram is called Health and Wellness Sport. Just go on Telegram and type and search Health and Wellness Sport. You'll see the Telegram channel. So that pen has a leaflet inside, and you guys don't read these things because even the contraceptives, they have the leaflets and the information is there. So the pharmaceutical companies have just washed their hands already. Is it going to get better? Do you have a father who is diabetic, an uncle, an aunt, a mother, a sister who is diabetic and is on insulin therapy? Are you expecting them to get better by taking that therapy? Are you? And then it looks so awesome. The pen looks so fancy. Now you have to inject the pen. Do you know the pain these people go through by injecting every time and then injecting again on their fingers to take blood sugars, even though blood sugars are not diabetes? We all know. If you're relying on pharmaceutical companies to actually help you reverse medical conditions, you're wasting time. They will tell you how to maintain the disease. That's why they will actually help you cope with the disease. Because if I'm looking at this infection like Candida, I'm looking at hygiene. I'm looking at medications that actually cause this. I'm looking at the conditions that will actually maintain me on this. No wonder our ladies are having recurrent yeast infections every single month. You treat today, next month she's coming back. You treat, she's coming back. You give those vaginal pessaries that they insert in their vagina, they heal today and tomorrow they're coming back. Why? Because we've never focused on treating the causes. We keep on treating the symptoms. Antifungals will not clear Candida completely because Candida inhabits the vagina naturally. So if you're using antifungals, you're only going to suppress the levels of this Candida. We'll still acquire them. So what we need to do is to boost the immunity so that it can suppress them.